या देवी सर्वभूतेषु दयारूपेण संस्थिता नमस्तस्यै 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 नमो नमः. To that Devi who is finding all human being in the form of mercy. Salutation to her, salutation to her, salutation again and again. Namaskaram and welcome to the channel Sanskara Ayurveda. Let's get started. Like a caterpillar turning into a butterfly has no idea that she is morphing completely a beautiful one. Exactly in the same way, a girl turning into a woman after first menstruation has no idea that she's morphing into completely beautiful things. And when it's about pregnancy, it's a transition period of a woman to welcome a new life that grows within herself. So during all that duration, she had gone through a lot of emotional fluctuation, physical and mental fluctuation. And with all that, we always have kept in our mind about healthy, how do we deliver healthy one. And to talk about all these things, we have epitome of Ayurveda, Dr. Sarita Shrestha ma'am. And to talk about all these queries, we have the founder of Divya Ayurveda Hospital, Bhaktapur, Nepal, Dr. Sarita Shrestha ma'am, who have been awarded with the 50 Women of Nepal who will change the way you see the world. Namaste ma'am.
Namaste again.
Thank you ma'am for accepting our invitation. So while talking about pregnancy period, we always have the queries in our mind what are the lifestyle and that we should have to follow for a healthy progeny. So there is something about Ayurveda that will uplift the health of a baby in our womb.
Yeah, sure.
And affect the development in a good way.
Yes. Ayurveda is also a spiritual science, right? It is that's the uniqueness and that's the speciality of Ayurveda. It talks about body-mind complex, and at the level of Atma, it talks about spirituality. That's where the whole world is now looking at Ayurveda, because yesterday I was just listening. I was just watching and listening one just by chance only. The happiest, the list of the happiest country in the world, and Finland. Finland is the happiest, the first happiest country in the world. And it was so interesting, they have very clearly said we are not competing with anyone. Our life is very simple, and we don't focus about money, we don't focus about competition, and we don't have kind of all those, the thing that's going after crazy. The whole world is going crazy after the world. And they are completely denying that. And that's how they have become the one of, the first happiest thing. And, I don't know whether they have understood the spirituality kind of, the spirituality definition of spirituality is so different to us, and that may be different to them also. But what I felt is they're truly in the state of spirituality, the Jnana Yoga part, you don't need to have, Eastern philosophy to have the Jnana Yoga. When you are in the state of, that consciousness, that is equilibrium, that is the state of happiness. So I was kind of amazed to see and listen that thing yesterday. I was just lying down, and then my husband just turned, just and then I kind of, wow, this is something that I could share tomorrow. So this is something very, very precious, I felt. And I'm going to link this with Shrutika Paricharya afterwards. So yes, the state of happiness is the most important factor during pregnancy, so we already talked about the do's and don'ts before conception, and so also is very much clearly said by said in Ayurveda by all authors and all rishis, that the do's and don'ts means that is what is called Paricharya in Ayurveda, means in modern concept you can say antenatal care. So what is the antenatal care that Ayurveda prescribes is right after conception. That's a beautiful again. Ayurveda has very clearly and beautifully explained about right after conception state, like Sadhya Grita Garbha. This is not explained anywhere else. So I would like and love to share one story with you all today. When I was, you mentioned, so I teach in USA, and I also practice as a teaching practice to the teaching to the students. I do the consultations to the people. And so one lady, she has a problem of infertility. We just talked about infertility, and she was in her mid-30s, and she was trying to conceive, and she couldn't conceive. And after we met few times, so one day she came and she held my hand and said, "Dr. Sarita, I think I'm pregnant." So I'm like, how do you know that? How do you know that? So she said, I just feel like I'm pregnant, and I'm going to check my the sonogram, and then I'm going to do the pregnancy test, and I'm sure I'm going to have it positive. That level of the confidence and on yourself, and then the insight that you have, a woman that can have insight in that level. I understand it is explained in Ayurveda, but I didn't know that a woman from West can have that also, So I was kind of, I was just amazed, and I was just looking at, really kind of thing. And then next week she came back to me and she just said, it's all same that I share with you. And then that moment I realized that, no woman in the world, is kind of backward or forward or kind of advanced. All women in the world have the same level of, the upliftment of consciousness is there. It's within you, So that's the thing, I realize, you can feel that. That Sadhya Grihita Garbha state anywhere in the world, and it is very clearly said by Ayurveda. And right from there, a woman has to be very careful to take care of yourself, a woman herself, because now she is not only herself, she is carrying two soul and two heart, right? So two body. So it's very important to take care of yourself and a new life inside you, right? So it's very interesting the way, Ayurveda has mentioned. It's very, profound, I will say. The title it is given is that a pregnant woman is like a vessel which is full of oil. Isn't that beautiful? When a vessel is full of oil, when just even a single drop can spill out any time, right? And that is the state of risk in a pregnant woman is mentioned. It is such a good example given. It has got such a weight, kind of explanations. So this is what we have to think about when a woman gets pregnant. Means you are taking care of yourself and a new life, so you cannot do anything wrong, whether it is at the level of physical, whether it is at the level of the emotional or mental. So it's very important. So this very much resembles, and this kind of justify now the story of Abhimanyu. You know Abhimanyu?
Yeah.
Right. So when Abhimanyu was in mother's womb, is it Subhadra, right? So at that time, Krishna was telling the story of the Chakravyuha, and in the middle of the story, telling by Krishna what happened, Subhadra got fall asleep, and then what happened is the communication between the external world and the internal world inside the womb was kind of transmission is over, right? And he couldn't get the whole story, so he learned how to invade the Chakravyuha, but after that, because her mother is her mother slept, so he couldn't listen how to come out. That's what the story told. And then when everybody was kind of, because he never learned practically in his physically in his lifetime, so everybody asked, how did you know, how did you learn it, where did you learn it? And then he said, I learned it from my mama Krishna in the womb of my mother. So that is the level of consciousness, that is the level of, like the mental state can happen, connection happen in a mother and a fetus. So anything, when, like any violence, any physical, like a kind of violence, mental, behavioral, any kind of hurt, emotional disturbance really affect a child inside, a fetus inside. So beside food, so like in the advanced society, modern society, alcohol, cigarette, and all those environment, drug nowadays, this is so much kind of becoming common, like in many part of the societies. So that is very dangerous, right? And then lifestyle, like we have to survive, so we go to work, and then the work environment may not be always how you feel and happier state, like there may be a lot of conflicts, there may be a lot of abuse, there may be a lot of so many other things which can lead to you unhappiness, which can lead to you kind of a state of very mentally disturbed conditions, and that counts to the growth and development of the fetus. So first 3 months, which is considered the first trimester according to the modern the Western philosophy, it is considered the first trimester is considered anything a woman takes or does can affect at the level of growth and development of brain and growth and development of the physical body also, which has kind of a teratogenic effect. When we say teratogenic effect means like abnormalities of the growth and development, so the baby can have that things also. So also with the food also, like I just want to say, like most of the time during the case of infertility, when I treat them, so they come to ask me, the patient asks me, what should I eat and not, that trend is still there in our society, what should I eat and what should not, and what should I do and not. So I used to tell them is like, don't eat radish, don't eat, like the pineapple, don't eat the papaya, all these things. There are many, like asafoetida, hing we say, and then timur we call timur. These things not to be taken because they have teratogenic effect, especially neural duct effect, development effect, and then also teratogenic, some part teratogenic effect, and more than that abortifacient. They will lead to miscarriage, they will lead to termination of the pregnancy in the first trimester, and even in the late kind of time also. So I do tell my clients, and so they do strictly follow. So it is very very important to know that, how I came to know, like, because when I travel from one place to another, in many places, to terminate, like unwanted pregnancy, people will give the raw papaya. So if it can terminate a pregnancy, means it can also, terminate a healthy fetus also. So that's why one thing. And so also with the we call mula, radish, also it's called daikon. Daikon also very strong abortifacient. It creates a strong contraction. So it is also not to be eaten. So these few things has to be not done. And in Ayurveda it is called garbhopakhatakara bhava, like it means which is harmful to the pregnancy, which will certainly help to terminate the pregnancy, right? And another things that what not to do is very interesting. Don't ride the, like the animals, kind of horse riding, camel riding, we don't have here, but kind of things. But we have very bumpy roads, like motorbike. Like a few years ago, there was a case, like the road from Maharajganja, the Baswari, to Kamlari was so kind of bumpy. And one, I don't want to declare the who, but there was a case, like a very kind of popular propaganda and kind of even issue. Let us say not propaganda, it's an issue. One ambassador's wife got terminated, got miscarriage because of that road kind of. So it was kind of from so much become an issue that the road has been kind of developed very quickly. So that the road, when it is bumpy road traveling or kind of exertion, kind of physical exertion and mental exertion also happens, then that can lead to termination of pregnancy.
So if we strictly follow Garbhini Paricharya, that is well mentioned in Ayurveda, what are the benefits of that, ma'am?
Beautiful. So I would love to share a few things, that I really like about Ayurveda, like Ayurveda, in modern or, in a Western concept of pregnancy and, growth and development, it's well kind of, every single step is well explained, especially anatomically and physiologically. But in Ayurveda, it is so well explained in a different way, like in a philosophical way. And it's very interesting, first month, it is called morula stage and blastula stage, kind of, division, which the vata plays the major role there, and the pitta will more related with the digestion, like the nutrition part, and then kapha is like kind of bringing more stability and kind of. So this is very much focus in Ayurveda. And then after third month, it is said that it is going to be solid in Ayurveda, and that's where the chances of having termination will be less, the miscarriage. So Ayurveda has very clearly mentioned about the definition, like the miscarriage and abortion. It's very, like before 3 months, 4 months, it is a miscarriage. As the garbhapata and garbha srava. I did talked about garbhopakat Ghat but I would like to say a little bit, like in Ayurveda, it is explained very well about masanumasik vriddhi, as well as masanumasik paricharya also. So monthly regime is there. So just because we have been talking so long, I want to say the beautiful part in Ayurveda is fourth month, where the heart becomes more prominent in function wise, and not physical or physiological, more emotional. So that's where it starts expressing its likes and dislikes. So when it is dislike, it is aversion, so a baby will kind of express, I don't like this, and a baby kind of express, I love this. So craving and aversion are parallelly going. So what I have noticed and what I have watched is, when a mother have strong aversion, the baby will never like in his life. It has been kind of seen now. And the baby who, like the mother which she craved in her pregnancy, the baby loves most. And this is why in Ayurveda said like when you give food, give such a sattvic and good food, so that the baby will throughout his life, kind of go through a normal pace and a wonderful, like intellectual way, like the greatest, like can be a great hero. Means hero means heroic activities, So it is said like, so 3 things very important is milk, ghee, and yogurt. Only these 3 are considered. So it's very sattvic food. So throughout the pregnancy, the safest food is milk, and ghee made up of milk, and then from the 3rd month, yogurt. So dahi, and also from 3rd month, the mamsarasa, the meat, and especially meat, the soup is kind of prescribed, and that has to be given through the digestive herbs, kind of, cumin, coriander, jeera, and dhania and adrak should be given. So this is our kind of measure. And from the in 4th month, it's very specifically said a woman, because of the weight of the fetus, the woman starts getting swelling, of the legs. So to reduce that, to give the herbal tea, and that herbal tea, if it is made of the gokchura, it's called Tribulus terrestris, and it is made of that tea. If given, it will increase the input of urination, so that swelling will be reduced because of the passing of urine. But the beauty of taking the gokchura is it doesn't lose the potassium. So that's the beauty. So it is given, and from the month of like nowadays the baby showering kind of thing. So more beautiful than baby showering, we have cultural very good feeding of the woman, the pregnant woman, on the 8th month, like the very nourishing food is given, and we call it dahi chura khwauni. In Nepali culture it is there, and that will kind of give the strength. It's like a preparation for the mother for the childbirth. During the delivery she should be strong. In Ayurveda, from the end of 8th month, giving the basti is kind of very much prescribed, and giving the massage, especially Shrestha had said the lakchadi tel is very good. So it will make your passage, the apana vata clear, the passage will be clear, there will be no obstruction of vata, and then it will strengthen the nerves and muscles and tissue, ligaments of the pelvic region, where which takes the major role during the childbirth. So this is beautifully said in Ayurveda. And like food wise, I already said the best food, and light and easy to digest food. Okay.
I hope it is somehow helpful for all the pregnant lady right there, and I know that. And thank you so very much, ma'am, for your valuable knowledge and sharing your experience with us. We are honored having you here, and you graced this event as usual. Thank you, ma'am.